system to then be able to understand where all the muscles fit into everything. So the functions of the skeletal system, the way that I like to remember it is, do you remember Sad Pam? Has anyone done that before?
Yeah.
Yeah, do you remember that? Can you remember what that all means?
Not really, no.
No? Okay.
I don't think I know what that is.
Okay, so Sad Pam, we use the letters to help us remember all the functions of the skeletal system. So we'll go through what I've got here and then we'll try and work out what the Sad Pam means. So first of all, it provides us a framework to support the body. So bone is strong, bone is hard, and it gives us a framework to attach everything else to, for things to hang from, for muscles to attach, to allow us to move. It gives us our shape. So our underlying structure is formed by bone. And that's why, have you ever seen when people do like facial reconstructions of people like in the Stone Age, and you can actually see what they look like? It's because they can tell that through their bone formation of their face. So the bones really do give us our most of our structure. It provides protection for delicate organs. So what delicate organs do you think that the bones provide protection from? Or for, sorry.
The heart.
Yeah. So what bones
lungs.
protect the heart and lungs? Yeah, good. What bones protect that?
The ribs.
Yeah, brilliant. So the ribs it's a cage around the heart and lungs, and it helps to basically protect everything in that, because that's quite essential for us to live, really. If our lungs and heart aren't working, then the rest of us won't either. Is there anything else that the bone encases that it might protect?
Mm-hmm.
Maybe a bit higher?
Oh, our brain.
The brain. So the brain is encased in its own helmet, basically, and that's the skull. We did a bit of that last week, didn't we? The skull.
Mm-hmm.
Yeah. So the brain is encased in that, and also we have our eyes, and we've got our sensory organs, so our tongue, our nasal passage with our olfactory cells in there. So all of those things are quite essential for our special senses, and that's all protected with through the skull. Does anybody know anything else that's encased in bone that perhaps comes from the skull and goes to the rest of the body? That's really quite important. So it's attached to the brain, comes out of the brain and down to the rest of the body. What is that?
Is it like our nerves and stuff?
Yeah, so it's the spinal cord. So the spinal cord's encased in our vertebrae, yeah, so our spinal bones. So there's a big hole in all of our vertebrae for the spinal cord to go through, because the bone protects it, because if it's damaged, then it doesn't fix. So it's really important that we don't damage that. So the bones of our body help to protect the really important things that don't repair very easily. So bones, you must have all heard that if you should drink milk to provide calcium for the bones. It makes the bones strong. Have you heard that?
Mm-hmm.
Yeah. So the other thing that bones do is they hold on to minerals until we need them. So it's a reservoir for minerals, and one of those minerals obviously is calcium. So we need calcium for other things apart from bone strength. Has anybody heard of anything that we might need calcium for ever? This is a bit advanced, you might not have heard it. Anybody got any ideas?
Mm.
No?
No.
Okay, so firstly, everyone needs calcium to be able to move, because you can't move a muscle unless there's calcium around. So calcium allows muscles to contract. So if you have a lack of calcium, then muscles don't contract properly and they don't work properly. And that calcium is taken from the bones. So this is why you need to make sure eating calcium to replenish the bones with that calcium, otherwise they do become weak. Another reason we need to store these minerals is really just for us women. And what do us women do that men can't do?
Breastfeed.
Breastfeed, yeah, but breastfeed what?
Milk.
Yeah, but
Baby.
what? Babies. So we've got to grow them. We've got to grow them first before we feed them. So yeah, growth of another human being, really. So their bones have got to be made from something, and it's taken from our calcium and our whatever we eat, and is stored in our bodies. And then as you go on to breastfeed as well, again, more calcium is needed because babies are growing really, really quickly. So you need more calcium to create those bones and to allow the bones to form. So women especially need that reserve of calcium and the reserve of minerals because, you know, we grow more people. So that's quite a lot. Okay. So as I said before, the framework allows muscles and ligaments to attach, and that in turn allows the body to move. So it basically keeps us together as a structure, and also allows us to move around. The final function of the skeletal system is to the formation of red and white blood cells. So this occurs in bone marrow. So if you were to take a traditional, like a long bone, like you see in cartoons that sort of dogs like, cut it in half. If you look in the centre of that, it'll be filled with a spongy substance called bone marrow. So you get red and yellow bone marrow, and bone marrow. The job of bone marrow is to produce blood cells. So it produces red and white blood cells, and then those cells are then taken out of the bones and put into the blood, which are the red blood cells, and then the white blood cells go into the blood, or they transfer to different areas of the body where they're needed. So to the skin, for example, do you remember the Langerhans cells that we talked about in the skin that basically keep the skin clean and keep the skin healthy? So they work there. There's other dust collecting cells in the lungs. So their original birthplace is in our bones. Now, the interesting thing about bone marrow and blood cell production is that as you get older, it gets less and less. So when you're a child, most of your bones contain red bone marrow, and it produces loads of blood cells. It forms your immune system. So, everything works really, really well. As you get older, more and more of your bones become filled with yellow bone marrow, which is basically a bit of a fatty bone marrow. It doesn't do a huge amount. And as you get older still, your immune system reduces. You tend to get more problems with your blood. So anemia, things like that happen. And you don't fight infection so well. And that's basically because you've got very small areas that just produce a little bit of these blood cells. So when you're about 88, the only place in your body that produces these blood cells is your sternum. Do you know where your sternum is? Anyone?
No.
So your sternum is your breastbone. So it's the bone that your ribs attach to at the front of your body. It just sort of really where your heart is. So that flat bone there is the only place in your body as you get old, when you get old, is that produces these blood cells. So that's why when you're elderly, you can't fight infection so well. That's why when you cut yourself, you don't heal as well, because you don't have the immune system to be able to deal with those things, which is really sad. So you have to be a bit careful. So here's the structure that I was talking about. So you've got the red bone marrow at the ends, and then in the middle you've got some of the yellow bone marrow. So remember, the red bone marrow is the stuff that you produces your cells. In the bones there are loads of blood vessels, because obviously the blood cells have got to get out and get into the blood. So you have blood vessels that run all the way through the bone. They aren't solid structures. There's holes in them all the way through. So when we talk about bones and the length of bones, we call them the bone shaft. So that's the length of the bone there. And you can see the red bone marrow, and then also the blue around the outside is compact bone. So that's quite hard bone, but it does allow blood vessels to go through. Okay. The red bone marrow sits in something called spongy bone, and that has little holes in it, so it looks a bit like a crunchy. So if you would cut a crunchy in half, that's what it looks like inside your bone, and then all those little holes are filled up with this red bone marrow. Okay, and that's what it looks a little bit more like if you were to sort of look at it for real. Obviously that's a drawing, but it looks a bit more realistic. So you can see all the blood vessels coming through, you can see the compact bone around the outside, and then you can see the spongy bone and the bone marrow. Okay, so bone tissue is porous, which means that it's not completely hard, it's not completely sort of watertight. Things can get in and out of it. It contains living cells, nerves and blood vessels, and it's a connective tissue, so it's cells within a matrix. So the matrix of bone is formed with collagen and hardened calcium. So that's what makes it a connective tissue, because remember, the cells are formed in something else. So it can either be a jelly-like fluid or something a little bit harder, as in bones, with this hardened by calcium, basically. So the collagen in bones makes bones less brittle, because if bones are brittle, then they'd snap more easily. They have to have a little bit of bend, so they're not completely hard, but they are the hardest tissue in the body. And then there are two types, which we've just talked about. So we have the compact bone, which is usually sort of on the outside of the bony tissue, and then we have spongy bone. And spongy bone is also called cancellate bone. So when you read the books, that your anatomy and physiology books, it will probably say cancellate bone, but that's what spongy bone is. And here's a better picture here. So you can see on the right side of the little wedge, that's your cancellate bone, and you can see the holes in it. And then on the left side, you can see the hardened compact bone. Now it shows you quite nicely how the bone forms around the blood vessels. Can you see the red blood vessels and then the rings around them? Everyone see that all right? Yeah, can you see the pathway of the blood vessel? So you've got the red things are the blood vessels. Can you see that they come from the sort of spongy bone area? So remember, there's bone marrow in there, and they go through the bone to sort of up through those little tubes and then out of the bone. Can you see that? So that's where the bone marrow, that's where the blood cells, travel to and from. So they travel from the spongy bone area through the network of capillaries, out of the bone, and then join into the main blood flow through the body. Okay, so those rings around the blood vessels there are formed through something called the Haversian system, and you can see it on the spelling online there. So that's basically the formation of bone in rings around the blood vessels. And bone is formed by osteocytes. So osteocytes are bone cells. And what they do is they form the bone, make it go hard with the calcium, and then basically cement themselves into the bone around these, in these rings around the blood vessels. And they stay there until they're needed again. So when we need to build more bone, when bones change, because they do change, the osteocytes, which are the bone cells, come out and they do their job and make some more bone tissue and harden it all off. Does that make sense?
Yeah.
Are there any questions? No. So just to recap, two types of bone. Compact bone, you have the Haversian system and the rings of bone, hard bone around the blood vessels. And then you have your spongy or cancellate bone, which is inside the bone, and that's where all your bone marrow is held. Okay?
Mm-hmm.
So this just says all that there. So this PowerPoint, I think, is on iLearn, but I can share it with you on Teams. I'll do that. I'll put it in the files. All right. So that's that. I'm just putting this on, obviously, because we are recording it, so you don't have to keep switching backwards and forwards if you're listening to the recording. And here's another nice diagram. So we've talked about the length of the bone called the shaft. Anatomically, we call that the diaphysis, and the ends of the bone, the epiphysis. So again, when you're reading your anatomy and physiology books, they may be referred to as that. So we can see a better diagram here with the Haversian system, with this compact bone outside of the bone, and then the spongy cancellate bone on the inside. So it just gives you a better view of it there. So we have two types of bone, but we have different classifications of bone, and this is basically, what have I done? There we go. Sorry. There we go. So this is basically classifying them into shapes, really. So they're classified into areas depending on their shape or their position in the body, and there are 5 classifications of bones. So we have long, short, flat, irregular, and sesamoid. So 3 of them you can sort of figure out what they're going to be like. So, but we're going to go through them now. So long bones. So the shaft or the epiphysis contains mostly yellow bone marrow, and then at the epiphysis is the red bone marrow. So they are very strong. They're usually found in the appendages, so this is your arms and legs, and are used for movement. So this is a picture of the femur, which is the largest bone in the body. Who knows where the femur is?
Is it like your thigh?
It is your thigh. Yeah, well done. So another example of this is your humerus, which is where? You should know this, girls.
Is it your arm?
Yeah, your arm. Well done. So they're really long, with sort of bulbous ends, really, that attach to your joints. So your hip joint is the top of your femur, and then your shoulder joint is the top of your humerus. So that's the long bone. Then we have short bones. So short bones are roughly cube shaped. They're not exact cubes, but they're quite squat. They are mainly cancellate bone. So what's cancellate bone? Is that spongy or is that hard?
Spongy.
Good, spongy bone. So when you look at a cancellate bone, and I have got, when you come in tomorrow, I have actually got a hand, a proper, sounds disgusting, I've got a proper human hand bone for you to have a little look at, and you can see the inside of one of these bones on it, and you can see there's a really thin layer of compact bone around the outside, and you've got all the cancellate bone on the inside, and it's really, really light. It's so light. It is worth having a look at and feeling it. So the bones of the wrist are short bones. So do you all remember those bones from level 2? Can you name any of them? No, don't worry, we'll do that again. But yeah, bones of the wrist. So if you look at that hand there, you can see that the short bones.
Isn't there metacarpals?
Yes. So
and carpals.
Yeah. So the
Yeah.
carpals in this picture are yellow. Okay, so they form the bones of your wrist. Then you have your metacarpals, which are the white long bones attached to the carpals. So the ones that are attached to the yellow bones, they're your metacarpals. And then you have your phalanges, which are your fingers. So the metacarpals basically make up your palm. Okay, so that makes up the palm of your hand. Then the phalanges are your fingers. So the wrist is a little bit, I always used to think the short bones there were the palm, but they're not. That's the bit that attaches to your ulnar and radius. So we'll go through a little bit more when we've got the skeleton tomorrow, so you can have a little look. We then have flat bones. So flat bones are flat. They're thin layers of compact bone with red bone marrow in between in the cancellate bone. So flat bones are, as you get older, that are the bones that form the red and white blood cells. So they're quite important. So an example of a flat bone is your scapula. So where's your scapula, guys?
Is it like by your shoulder?
I can't remember.
Yeah, it is your shoulder. It's your shoulder blade is your scapula. And on this PowerPoint here, it says hip bone. You haven't got a hip bone, okay? It's your pelvis. Your pelvis is flat, like your scapula. Also, the bones of the skull are flat as well. So they're quite thin. It's like a bone sandwich. So it's got compact bone on the outside with the cancellate bone on the inside with the bone marrow. Then we have irregular bones. So irregular bones basically don't fit into any other categories. They've got bits on them. So a really good example of an irregular bone is a vertebrae. So here we can see this looks like a lumbar vertebrae. So this means it's in the lower back. Quite a big, thick, chunky bit of bone, which would normally be a short bone. And then it's got this like spine on it, this fin. So that's what makes it irregular. So it's irregularly shaped, doesn't fit into any other category. The final type of bone is a sesamoid bone. We don't have lots of these in the body, but the one that tends to be on everyone is the patella. Now, the sesamoid bones develop in tendons, so they're really quite weird. Your sesamoid bones aren't there when you're born. You develop them later on. So if you ever feel the knees of a baby, they don't have kneecaps. So kneecaps don't really develop fully until you're probably about 6 to 12. So when you look at a child's kneecap, if you looked at under an X-ray, it wouldn't look fully formed. It'd look like it was broken. But actually that's because it was developing. And if you do look at babies, they don't have them. So that allows them to crawl around on the floor without their knees becoming injured. Because have you ever tried to crawl around on the floor like a baby does? It hurts a little bit because of the bone. So babies don't have it. Okay, so next time you see a baby, you'll have a little look at their knees. Ooh, what's going on? Has someone got their phone and the laptop going? Or something going on? Yeah. Can you turn the sound off on one of them?
Yeah, I'm just. There you go.
Thank you. Right. So the skeleton is divided into 2 parts. You have the axial skeleton and the appendicular skeleton. So appendicular skeleton is your appendages. So it's your arms and legs, and that basically gets you moving. And then your axial skeleton forms the axis of the body, and they're mainly protective bones. Okay, so you've got the spine, you've got the rib cage, and you've got the skull. So that's the 2. So when they talk about axial and appendicular, those are the areas that they will talk about. And I think that's probably in one of your exams. So do make sure that you know the difference between them. All right. So appendicular skeleton holds the shoulder girdle, arms and hands, pelvic girdle, and the legs and feet. So we talked about the shoulder girdle in class last week. So the shoulder girdle is basically your scapula and your clavicle with your humerus attached, which is your shoulder. These are I haven't got my, it doesn't show my little pointer. So the one at the top is the scapula. You can see that's flat, it's a flat bone. And then we have the clavicle. So the clavicle is your collarbone, and you can see that that's a long bone there. Okay. We can see on this diagram up in the right hand corner, you've got the shoulder girdle, and then you have the arm. So this is really nice because I like the colour coding because it really quite clearly shows you where everything is, and I like to work with colours and pictures, so this is quite nice for me. So your blue bone is your humerus. You've then got the lower bones of your lower arm are the radius and ulna. So the radius attaches to the lateral part of your arm. It's basically the part that is nearest the thumb. Okay, so if you're ever unsure where your radius is, check where your thumb is and then just work your way down. We then have carpals.
Doesn't mean your business has to stop. Ensuring your team stay connected is a priority.
Oh, what's going on there? Thank you. Right, so carpals are your red ones, that's your wrist, and your metacarpals are green, and phalanges are yellow. So phalanges are the fingers, remember, metacarpal is the palm. Okay. I'm going to flick through these because you can go through them on the PowerPoint I'm going to send to you. So there are 8 carpal bones held together with lots of ligaments, but the different bones allow us to do some really quite intricate movements with our hands. Now you're going to need to know the names of all these. Do you remember these? Any of these names? Did you learn these at level 2?
I know your scaphoid bone.
Yeah? Where's your scaphoid?
No, I haven't. That's near your thumb.
Yeah. So scaphoid is near your thumb. Don't worry if you didn't learn these at level 2. We're going to learn them now. So looking at it, looks like you're looking at a right hand palm up. So your scaphoid is by your thumb. So if you follow your thumb, okay, hold on to your thumb and then follow it down. So you'll feel at the bottom the joint between the thumb and the trapezium. Okay, the trapezium, you can't really feel it, but it has a little sticky out bit. And the sticky out bit has a sort of a tight band of tissue attached to it that goes across to the other side and attaches to the pisiform. So if you go to the other side of your hand, follow your little finger down the outside, down your hand, and then at the bottom of the wrist you'll feel a lumpy bit. That's your pisiform. So your pisiform is like a little round bone that sits on top of the triquetrum underneath. Now the trapezium and the pisiform have a band of tissue that sort of connect them, and underneath you have lots of blood vessels, and you also have nerves and tendons. Now that little tunnel there has a name. Does anybody know what a little tunnel in the hand might be called? A little tunnel through the carpals. Has anyone heard of that? Anything like that?
No.
Okay, so it's actually called the carpal tunnel. Has anyone heard of carpal tunnel syndrome, or anyone had carpal tunnel?
I've heard, now that you've mentioned it, I have heard of it.
Yeah, so you have like nerves and tendons that go through there, and if it becomes damaged or inflamed, it gives you really awful pain and tingling in your fingers. It's quite common in pregnancy and people that sort of work on computers a lot and that or people that use vibratory tools, that really irritates that area. So that's your carpal tunnel. Forming the base of the carpal tunnel, you have your trapezoid, which is basically underneath your first finger. You have your capitate, which is underneath your middle finger, and then you've got your hamate. So your hamate, again, that sort of forms the carpal tunnel forms the wall of a carpal tunnel as well. It has a little hook that hooks up, but your hamate is attached to your little finger and your ring finger. Then at the very bottom you have the triquetrum with the pisiform sat on top, and then you have your lunate. So your lunate attaches quite nicely, or fits to your ulna. So do learn the names of those bones and where they are. You possibly will be tested on them. So it's quite important. So, you know, I used to, I think I had a little, I'll see if I can find it. I had a little rhyme that would help me remember them. I'll see if I can find it for you and tell you. I can't remember it now. Right, so then we have got the pelvic girdle. So the pelvis is quite a very important area, and it's made up of several bones. Although it's all hard, it doesn't move, apart from the joint between the ilium and the sacrum. It is different. They are different bones, okay, and they've become fused. So the very top of the pelvis, you've got these sort of two ears, because I think it looks a bit like an elephant. So the two ears of the elephant are called your ilium or your ilia, and they form your hips. So when you have where your jeans fit around your hips, I don't mean your hip bone or your hip joint. I'm talking about when people talk about their hips. They form your sort of the widest part of your hips. Joined in the middle to the sacrum, they provide connection between the lower body and the upper body, because the sacrum is the bottom of the spine. As you go down the ilium, you can see a bone that comes through and forms sort of the base of where our tummy is. So our tummy is there at the bottom, our digestive system, and our uterus and bladder sit quite nicely behind that. That is called your ischium. You then have the bones that form in the middle, which are called your pubis, and that middle pubis symphysis, or symphysis pubis, is a cartilaginous joint. So although it is quite a joint that doesn't move very much, it does give some movement, because the pelvic ring does take a little bit of knocking every now and again. So if we fall over, we do want a little bit of give, because if it didn't give, it would shatter. Okay, so when we talk about the pelvis, we talk about the ilium, ischium and the pubis. Bones of the leg. So femur we've talked about, patella we've talked about. You should know tibia, fibula, your tarsals, metatarsals and phalanges. So I'm going to go through these quite quickly, because I want to get onto your tarsals. So there are 7 tarsal bones, one less than the hands, carpals. So these are a little bit easier to understand. So you have, if you're looking, you can see sort of how the foot's sort of lying. We're looking down on it here. So going from the top left, you have the medial, intermediate and lateral cuneiforms. So these bones form the arch of your foot. So when you look at the arches, those are the bones that are forming it. So they form the arch. So it allows you to move when the bones to move when you're running, and it doesn't break anything when you stomp your foot down. Next to that, on the lateral side, you have the cuboid. Underneath the cuneiforms, you have the navicular, which is quite a square bone again. So these are all short bones. Then the 2 at the bottom are quite interesting. So please, when you come in tomorrow, have a little look at the foot on the skeleton, because they sit on top of each other. So the talus sits on top of the calcaneus. So your calcaneus is your heel bone, and then your talus sits on top of it. So it is quite an interesting joint, but this allows you to be able to walk over uneven surfaces. Okay, so the arches of the foot are, we have a medial and a lateral. Oh, sorry. Oh, gosh. There we go. So the medial is on the medial aspect, so on the inner part of the arch. The lateral is on the outer side. You then have an anterior and posterior, so we know that means front, and then we know that posterior means back. So when we have a look at the arches tomorrow, you can sort of see where they are. But I don't think that's in any of your exams, so don't worry too much about that. So we know the axial skeleton is made up of the skull, vertebral column and rib cage, as well as the sternum. I'm not going to go through the joints, the bones of the skull, because we did that last week, so you should have been revising that. So it will all be on the PowerPoint if you want to review that. I'm just putting this up here now, so if you want to stop the video on the playback, you can. What you didn't see and what we didn't talk about last week is the palatine bone. So your palatine bone forms the roof of your mouth, so it's a hard bit of your palate and allows you to sort of move food around your mouth and allows you to swallow. So that's the head obviously turned upside down, the skull. Then we have the vertebrae. So we talked about that last week with the different sections. And then we talked about the ribs and the thoracic cage and what's in it. Okay. Now the reason that the ribs are cage-like instead of a solid structure like the skull is because we breathe and the lungs expand and contract. So the ribs allow us to do that. So each rib has its own little joint. So at the back, and then at the front it's got a cartilaginous joint. So at the back it has a movable joint, and at the front it's got a semi-movable joint. So the thoracic cage has got quite a lot of movement to it, which is handy so we can breathe. So that's the sternum, which is your breastbone. These parts of the sternum won't be in your exam, so don't worry about learning the manubrium, the main body, and the xiphoid. But if you ever do come across that, that's what they mean. It's just the different areas of the sternum. Okay, there are 12 pairs of ribs. There are 7 true ribs, which are attached to the sternum. 3 pairs of false ribs, which have a cartilaginous attachment at the bottom, you can see. And then there's 2 pairs of floating ribs around the back. Again, come in tomorrow, have a little look at the skeleton so you can sort of see where they all are. Okay, so it's just a recap there of anatomical terms for you. And I think we're about done. Okay. Are there any questions with that?
No.